From Reddit.com AskReddit subreddit, doctors and nurses of Reddit, what have been your why didn't you come in sooner moments? Imaging guy here. I have a million of these. I work with vascular patients and wounds. Had a guy whose foot was completely broken sideways at the ankle. He had it still wrapped from when he left the hospital. He would use the stumpy part to move around on his wheelchair and leave little blood sponge prints on the floor. Another guy with bad ankle and foot wounds decided to stop going to wound care, and was afraid to take the wraps off even after his foot started to stink. By the time I saw him, his skin had kinda liquefied. Earlier on in my career, I saw a guy with necrotizing wounds to both legs that had eaten to muscle in multiple places below the knee. I asked him how long they looked like that and he said about 2 years. Next time I saw him, he was bilateral above knee amp. Stump wounds. Just stump wounds. Take care of your feet, people. If you're diabetic and can't feel the bumps and scrapes, please check your feet regularly. Former medic here. Called to a patient who had cut their leg while chopping wood about a week prior and now it was really itchy. Old gentleman, didn't drive, lived alone. Got to his house, unwrapped the ungodly swollen leg to find that he tried to superglue the wound closed and maggots have commenced to growing inside. The itching he was feeling was the writhing maggots under his skin. On the plus side, the maggots likely kept him from developing sepsis. Guy came in with a dead leg. Waited until it turned black and then decided to head to the ER. They tried an angiogram to open up blood flow, but it was way late for that. Guy had several clots in his lungs and legs. Undiagnosed atrial fibrillation. He couldn't believe we were going to amputate, kept asking me what else I could do. Go back in time a week ago and come in. Kinda around when it turned blue. It's amazing a person can have a dying leg, blood clots, which I get he might have never noticed that one, plus a heart condition, and still not feel the need to go to an ER at the very least. This happens all the time. People have a big stroke at home and can't move an entire side of the body. They wait several days thinking it's a flu or something. Nope, not the flu. Just a large clot in the brain that could have been reversed if you came in right away. In the case of a stroke, they might also not be able to even recognize the severity of the symptoms, or even be able to appreciate that the paralyzed body parts are their own. I was an EMS supervisor for a while, and once ran on a patient with classic stroke symptoms, sudden onset one-side paralysis. She was still able to talk, though, and insisted that she neither needed nor wanted to go to the hospital. That was why I, as the supervisor, had been called. The paramedics on the scene, good paramedics, knew they were treading that thin line between necessary transport and the patient's stated desire to not be transported. So I talked with the patient for a little bit and ran into the same problem. So I touched the patient's good leg and asked her if she could feel that. She said yes. Then I touched her bad leg and asked if she could feel that. She said no. I asked her if she could tell me why she couldn't feel it, and she replied that it wasn't her leg. I knew she needed to be transported, and that reply was all I needed. I told the medics that they could transport her, because obviously her mental acuity was impaired to the point that she was unable to make informed judgments on her own care. I made sure they knew that that was the way to write the report, too. And once we started to load her up, she provided no resistance at all, which is pretty much what I expected. Never got any word back on how she did, but also never had that decision come back and bite me in the ass. People who have had a stroke are, obviously, not thinking right. When my granddad had one, his biggest concern was not wanting to go to the hospital before he put his socks on. He slowly put on one sock, got the other sock, and put it on the same foot. He realized that was wrong and took the socks off. Then he started again, with the same result. He repeated this multiple times until we had to beg the ambulance dudes, who were standing there watching, to just take him regardless of if he said he was ready or not. At the time I thought he was doing the sock thing because he was just so confused. But now I wonder if he was doing it because he knew he had two socks to put on, but didn't recognize the other foot as his. My mom had a stroke browsing in a store with my dad and me. I just happened to go looking for her and found her sitting on the floor next to my dad. She was a very dignified woman and would never sit on the floor in public, so I knew something was very wrong. Immediately started thinking stroke when I heard her start trying to speak. But the two things that were most astounding in the moment were, 1, how hard she insisted there was nothing wrong with her, and 2, that she just didn't recognize her left side as part of her body anymore. She was also extremely concerned about where her purse was. I can't thank the EMTs, doctors, nurses, physical therapists, medical aides, etc., who helped her in the aftermath enough. She lived, but never really regained mobility, and completely lost all math skills, before dying 5 years later. Learn the signs of a stroke. Don't let your loved ones convince you there's nothing wrong. Years ago, as a nursing assistant on an oncology floor, we had a guy admitted because he had had an erection for several days and had lost the ability to pee. His bladder was close to bursting and his poor junk was. Think microwaved hot dog. Really bad. But none of that was as interesting as the fact that this guy had untreated skin cancer on his nose for several years that had over time become infected, developed MRSA, and spread across his face. He had no nose, no cheek, and no eye on one side of his face, and was starting to lose his other eye. You could see part of his fucking skull. I don't know why he chose to leave it untreated, and I have no idea how long it took to get that bad, but I will never ever forget the smell and texture of his rotting face. On the upside, we were eventually able to convince him to have reconstructive surgery. He ended up getting a skin graft that covered up his eye, nose and cheek. So, if you ever meet a very grumpy dude with nothing but a mouth and one eye, know that this is way better than the alternative. Doctor here, might be a bit late and will probably be buried, but had a 65-year-old dude who was diagnosed with lymphoma 8 months before we saw him. He lived an hour out of the city and didn't want to drive in for treatment, so decided he wouldn't get treated at all and stayed on his little remote place in the country by himself. Essentially, because it didn't get treated, it spread along his skin and his neighbors called an ambulance when popping in on him. It had spread so far that it essentially went from his head to his knees. It had started to invade his eyes and mouth membranes. He couldn't drink and could barely see. His skin had started to slough off and he was so severely dehydrated because he was losing so much excess fluid from his open skin that we had to treat him like a severe burns patient and had plastics involvement. The consultant said if he had received treatment, there was a chance he could have recovered. Instead, he died 3 weeks later. Once had an older lady call in wanting a prescription for pain meds because she was sure she had shingles. Said her neighbor had them and she was sure that's what it was. She hadn't been in for an exam in almost 2 years, so the doctor asked that she come in to be evaluated before a prescription could be given. She refused and called again the next day asking for a prescription. This went on all week. Her calling for pain meds, the doctor asking her to come in to be seen. She finally agreed to make an appointment. It wasn't shingles. It was a skin ulceration from advanced breast cancer. Frown. This has happened a few times, actually. But I had a gal come in on Monday after being discharged from the hospital Friday after giving birth. So basically, we tell ladies to avoid intercourse until a doctor clears you, and well, her spouse kept insisting and insisting and insisting that Friday night she caved and let him go to town. He wound up tearing some stitches that were placed and bleeding like a stuck hog all weekend long. Came into our clinic, blue in the lips and fingers, and her hemoglobin was 4, normal should be 12 to 15. She didn't want to be a bother, so she waited until she started feeling dizzy all the time. She got another trip to the hospital for transfusion and repair for that. But, like I said, this isn't the first time I've seen that, so for the love of God, if homeboy is begging for it after you just had a baby, maybe he needs a lesson in self-control and a bottle of moisturizer. I've seen a few over the years, and they generally fall into the category of if it's not diagnosed then I can't have it, or I didn't think it was that bad. As a medical student, I remember an older lady that had a breast that was necrotic and falling off. It had been progressing over the last several years. But, if she didn't get diagnosed with breast cancer, then she couldn't have it. In the other category, I've seen a few cases of Fournier's gangrene. Pretty much obese, male diabetics that had a pimple/sore that started in the pubic region. By the time they come to the hospital, it's a raging infection where the treatment is basically to cut away everything in the pubic/groin region down to the muscle layer. That little sore didn't seem like much at first. Not a doctor/hospital staff, but my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago. He was tending to one of his mules when something spooked it and he got kicked in the gut. He was in a lot of pain, could barely move due to the abdominal pain, so decided to take it easy and lounge on the couch for a week. He refused to go to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doc said it was huge, like volleyball size huge, and he may have survived if he came in sooner. By the time we got him to the hospital, he had a severe case of gangrene. His leg needed to be amputated within a day of him being there. He passed away a week later. Children's nurse here. My first week in pediatric ed, we had a young girl, 6/7, come in with a really swollen jaw/face. Poor girl was unable to move her jaw without intense pain and hadn't been able to eat for several days. Turns out she had only just started cleaning her teeth for the first time ever and managed to develop several abscesses and rotten teeth in the process. To make it worse, her mom told us she was recovering from the same procedures to remove most of her teeth because of almost the same thing. They didn't want to bother the GP as they thought she was just messing about to get out of school. Had a patient brought in by her son who took care of her. When she arrived to her unit, I performed a skin assessment, took off her socks and found a fallen off gangrenous toe. Seems fake and I wish this was, but it was by far the nastiest thing I've witnessed. Son said he had no idea when his mother's foot became that bad. No words. I hate this because half the time, the family is trying their best and simply overwhelmed with the level of care their family requires, then sometimes they visit mama once a day and say you good? And act like they're infallible. It's a complex answer that's different for everyone. From what I've seen as a nurse, it's the little things. Not taking a shower every day, finding them in the same clothes they wore the day before, losing weight because they don't feel like eating / the food they eat is garbage, medication mishaps, forgetting to take them, taking too many / not enough. Keep an eye on their teeth, their skin, their hair. Listen to what they say. I think I stepped on something the other day, but I looked and I couldn't see anything. 3 days later you notice a large sore on the bottom of their foot where they couldn't bend over to see. Watch their elbows and heels, the place right above their butt if you can. Bony prominences develop bed sores awfully quick when all you do is lay in the bed / chair all day. Mobility is a huge factor in senior health. Lose that and things can go down quickly. Watch for loose cords, unstable rugs, worn down shoes. Clear their yard of leaves. This time of year is horrible for older people as things are getting slippery. I am currently sitting and waiting on my 4th patient who has fallen and broken something to come out of their OR. It's not just the shower and the dog that trip people up. Like I said, everyone is different, but you have to pay attention and not be afraid of addressing something and making a big deal out of something you know is off. No, talking about how grandpa's breath smells like death and his teeth are caked and breakfast and lunch and dinner is uncomfortable and you don't want to hurt his feelings, but it could be he forgot or he just isn't caring anymore. Things that can be hard to talk about need to be talked about with old folks. I'm just a nurse and I'm sure there's plenty of healthcare people and caregivers who can summarize it better, or more clearly. Obligatory, not a doctor. I was sitting in a hostel with an emergency nurse and an emergency doctor that had just found out that while they worked on different continents, they did similar work. We were happily chatting along and this older guy walks in. He overhears that they're in the medical field and comes up to see if he can ask a question. He shows them his leg, that's got large black spots on it everywhere below the knee. Both the nurse and the doctor look at it and immediately go, "You have to go see emergency services. That leg is necrotic, you'll lose the leg if not your life," and the guy goes, "Ha, that's what my doctor back home said too. But the leg feels fine, I'd know if it was dying." You're wrong. Besides, I'm not gonna ruin my vacation by seeking medical treatment, which left me wondering why he asked in the first place. He goes to sit at the bar and over the course of the evening both the nurse and the doctor leave the table to try to get this guy to understand that he may not have 10 days until he's back home, that he needs to have this looked at now without success. Maggots in the abdominal/genital skin folds of a morbidly obese woman who refused to let her daughter take her to the doctor until the smell was so bad the neighbors complained. Saddest, grossest patient issue I ever saw. And she was inpatient for weeks, with Q4 dressing changes that needed at least 4 people to assist. Awful for her, awful for us. I just wanted to mention what take care of your feet actually means, since you seemed concerned. You want to wear shoes for most of the day to protect your toes and the soles of your feet. Get yourself a nice pair of house shoes and change out of your outside shoes when you get home. Don't wear the same shoes every day. Get at least 2 pairs and alternate. This lets them air out, which means it prevents bacterial growth and as a bonus your shoes last longer. Check your feet before you go to bed, daily. Look at the nails, between your toes, and at the soles. If that's difficult for you, ask a loved one for help. You're looking for abrasions, injuries, or discoloration. I once had a roommate who was walking around with a broken toe for over a week because he couldn't feel it and he didn't check his feet. Do not get pedicures at nail salons because it can increase your risk of bacterial infection, but do make sure that your toenails are kept a good length. You want them long enough to protect the end of your toes, but short enough that they won't snag on things. That's about it. If you have any other questions, I'm happy to help. I got really sick really fast, but didn't realize it. I had stage 4 Burkitt's leukemia CNS positive, which is very important to know. Less than 100 people my age will get that cancer each year in the USA, so pretty uncommon. Anyway, I got super sick just over a year ago, and just happened to have a doctor's appointment scheduled. Went to the appointment and felt like absolute trash, sweaty, hot, lethargic, lightheaded, Terrible heartburn, and just tired. Also could barely breathe. My dad, who was driving me to the appointment, had to wake me up, and I remember him saying, "Get up, fat ass, we have a doctor's appointment to get to, you better be fucking sick." In his defense, he had no idea, and neither did I, just how sick I was, as 2 weeks before I was fine, working in South Carolina on a construction job. So we get to the appointment and I get blood work and an ultrasound of my chest cavity. The doctor saw the ultrasound photos and was stunned. Then saw my blood work and told me to get the fuck back to the hospital, as we left to go home and would hear the results later. Doctor saw 7 tumors on my liver, the biggest on the size of a grapefruit and the second largest the size of a baseball, and then saw my blood work was trashed. Diagnosed me with cancer and said it was a miracle I was awake, let alone walking and cracking jokes. Only found out later that Burkitt's cell can double in size within 24 to 48 hours. Doc wondered why I hadn't had problems with my monster tumors before, since I only scheduled the appointment to fix heartburn. DL, doctor, I made a doctor's appointment for heartburn, got diagnosed with super cancer. A lot of times young men will come in complaining of a cough that won't resolve. Usually the doc will ask if either testicle is swollen and the guy will say, "Well, yeah, now that you mention it." They won't come in for a swollen testicle, but they will come in for the cough. Unfortunately, by that time, the cancer has already metastasized to their lungs. Edit. Okay guys, please touch your balls on the regular. Especially if you're a young guy. Don't be shy and speak to your doctor if something feels amiss. Hold your penis out of the way and examine each testicle separately. Hold your testicle between your thumbs and fingers with both hands and roll it gently between your fingers. Look and feel for any hard lumps or nodules, smooth rounded masses, or any change in the size, shape, or consistency of your testicles. I work in orthopedics. A very common occurrence is a patient is told to follow up within the week. We like to see fractures between 5 to 7 days, and the patient will call on the 6th day and say, "I broke something and need to be seen tomorrow." This is frustrating because we very rarely have the ability to get a patient in next day, and if they had called the day of or the day after, then we definitely could have gotten them seen. But my number one "why didn't you come in sooner?" moment was getting a call from a patient who had broken their forearm 2 months ago and never followed up. I got them scheduled, they no-showed their appointment. Rescheduled, they no-showed. Second reschedule, they arrive with a very obvious deformity to their arm due to the fracture healing incorrectly. If they had just come in, it wouldn't have been an issue at all. Blows my mind that they went almost 3 months without care. I was working as a surgical junior when my team was called down to A&E to see a patient who had come in with a complication from a recent hernia operation. When we came down, we saw that the patient was holding a plastic bag over their abdomen. When this was removed, we found that their wound had opened and their intestine was visible to the air. It transpired that this was not something that had happened overnight, it had taken several days. The patient had started using plastic bags and newspaper to dress the wound when they ran out of dressings. Edit, addendum, because this is getting a lot of views, I must stress that this case was exceptionally uncommon, and an example of what happens when someone does not seek medical attention when it is obviously required. In general, hernia operations are very common and very safe. That being said, if you have any surgical procedure and you are not certain the wound is healing properly, you must seek medical attention. My girlfriend is a care worker and she recently told me that she slipped off a patient's slippers and remarked, "I didn't know you had lost your dose," to which the patient responded, "Well, I hadn't till you took the slipper off, dear." Sounds like something from a grim sketch show. God bless anyone who can do jobs like that. Story from my sil, who is a nurse. Young man was brought into the ER. He had a sinus infection that he had let go to the point that it had eaten through the skull and into this brain. She was told that it had started several months before. He didn't want to go to the doctor for it. All it would have needed was 10 days of antibiotic pills. Instead, he was not brought in until he was unconscious, and died within a few hours. A&E/ed doctor here. A farmer in his 70s reluctantly came in with his wife after falling over outside while wrangling a sheep 1 week earlier. He did not want to be there but had been forced to come by his wife, who was worried about him. On questioning/examining, he was pale, short of breath, and clearly in pain all over the right side of his chest but not wanting to show it. X-ray and blood showed he'd broken loads of ribs, punctured his lung and bled profusely into his chest and was now very anemic. Rural Midwestern USA here. Your average old farmer here tends to wake up and start slamming whiskey, smoking cigarettes, and going to work on the land. One of my dad's friends, who was in his late 60s at the time, once was cutting up a fallen tree. The chainsaw jumped and went right into his leg, down to the bone. He fucking drove himself to the hospital with his leg rapidly bleeding out, and he's still working today, though alcoholism is really starting to beat him down now that he's in his 70s. Patient here. For 6 months in 2014 I complained to my family doctor that it felt like I swallowed a Super Bowl and it had gotten stuck, and that walking to the mailbox and back caused me such labored breathing that I needed a 10-minute break to catch my breath. I was also coughing up quite a bit of blood from time to time. He was getting annoyed by my complaining and would just keep prescribing steroids. He told me that because I was fat and a smoker that I needed to accept that I had COPD and that was going to be my life from now on. I finally said, look, send me for whatever type of test will look that far into my throat, and if it comes back as nothing I will stop complaining. 3 weeks later I had a sonogram and they asked me to stay for another test, and then they started freaking out and said I had to go from the testing facility to the ER in an ambulance. Their hospital refused to see me, so they sent me to a different one that also refused to see me. We still had no clue as to what was going on. I finally get taken to my current hospital/medical center and they tell me I need emergency surgery to try and remove the cancer tumor that is growing inside my airway. I only had 4 millimeters, a coffee stirrer, to breathe through. Had I not made that deal and had just accepted that not breathing was my new normal, I would have only lived another week or two. My family got a new family doctor. I was diagnosed with terminal stage 4 cancer, throat, lungs and spine in April of 2015. I am losing my fight though and started home hospice 2 weeks ago. I put up a good fight and I am so thankful that I didn't die in 2014. I had a patient come in saying he couldn't see. How long had it been going on? For 5 days. The man had been blind for 5 days and didn't come in because he thought it might be like a cold or something. During the exam when I asked him to move his legs he said, "Oh, I can't do that?" I asked how long he'd been unable to move his legs or walk. Wife chimes in, about 2 years. Never saw a doctor about it, they just borrowed a friend's wheelchair and kept it rolling. Turned out he'd had multiple strokes with multiple risk factors he never addressed. Given how little insight he appeared to have into the condition, I honestly felt sorry he didn't have insurance, so I'm sure that played a role in him avoiding seeing anyone. Not me, but my brother is an EMT for a warehouse. He recently had a guy come to his station saying something was wrong with his toe. So he asks him to take off his shoe, which he does. My brother was about to ask him to take off the bandage around his big toe before he realizes that that wasn't a bandage, it was his skin. Apparently, this guy dropped a 20-pound weight on his toe a week earlier and had been showing up at work anyway. They sent him to the doctor sent him to the ER. Diagnosis came back as a tissue infection as well as osteomyelitis, a bone infection. But wait, there's more. The guy come back from the ER and tells him that he doesn't want to go through the ER doctor and would rather go through his own insurance. My brother explained to him as best as he could that, as it stood, he was already likely going to lose his toe, and if he waited any longer to get it treated, he ran the risk of losing his entire leg. Not sure what happened after that, I just hope he got the point. Dude, I fell when training at an indoor climbing wall once, fell literally 1 foot, if not less, and hit my leg. A month later the little scab falls off and there's just nothing. There's nothing behind the scab. No granulation, no healing, no flesh. Went to the hospital with a plaster on it, it was small. The nurse took the plaster off, stepped back and immediately went and got a surgeon. They thought it was osteomyelitis. They legit said, "We're discussing whether to take that bone out of your leg." That was my personal "I should have come in sooner" moment, and now anytime I see osteomyelitis I fucking shiver. We all discussed it and they decided since it didn't need surgery after all, I could just take some very strong antibiotics for a week and it'd be fine. But they had one of the medical techs scrub it out first. That was incredibly painful. At one point he was trying to clear some pus out of it. We're talking a hole maybe 6 to 8 millimeters across and deep, and we simultaneously realized it wasn't shifting because it wasn't pus, it was fat sitting on what was left of the muscle. It's been 2 years and I have a small scar and a very weird feeling dent in the front of my leg. Not a nurse/doctor but a lab scientist. Had a guy come in at the end of the day for chest pain that's been bothering him all weekend. The ED doc ordered a troponin blood test which helps rule in/out heart attacks. If the test runs above 0.03, we consider that a sign for a heart attack and act accordingly. This guy's very first troponin was 21.00. 21. The highest we've ever had up till then was an 8.00. The guy should have been dead ages ago, but he somehow pulled through. Don't ignore chest pains, people. Edit. Just want to clarify that the hospital I work for is a tiny-ass, 25-bed, rural community critical care hospital. Definitely not a place with dedicated cardiologists, cath lab, bedside assays, or even a big test menu, period. Bare basics. And the guy did, somehow, end up surviving. Oh, so many stories here. We can start with a gentleman in his 70s who was diagnosed with diabetes. His doctor had instructed him that it's important for him to wear socks and supportive shoes throughout the day. So this guy decides that meant wear the same pair of socks for weeks and never take them off. He had showered, slept, and carried on in the same pair of socks for weeks. He came to the ER because there was blood oozing through his sock and there was pain under there. Take the sock off, he's got a diabetic ulcer that had opened and was full of maggots. Not a pretty sight. We clarified those instructions pretty quickly. Nurse here. I work in a very rural hospital, and we have a patient population that seems to avoid the hospital at all costs. I have had so many, usually related to diabetics with foot sores almost always resulting in amputation of a toe, or more. However, my favorite was an elderly farmer who came in with chest pain that wouldn't go away, as he put it. When we asked him if he had it before he had said that he had been having chest pain on and off for years, but it would typically go away after he grabbed his electric fence. Apparently, the first time he had the pain he was standing out near an electric fence on his farm, and he reached out to steady himself and accidentally grabbed the electric fence, which shocked him, and made the pain go away. So after that, whenever he would have the pain, he just went and grabbed the fence and it made him feel better. He had literally been cardioverting himself for years. He was fixed up and sent on his way, but we all still chuckle about it now and then because he was so nonchalant about it. My sophomore year of college I started drinking coffee. And, as college students can be wont to do, I drank a lot of it. One evening, during midterms week, I get a bad headache, so I drink some coffee and settle in to churn out a few hours of work. My headache goes away, but I start noticing tingling and numbness in the right side of my body. It eventually gets bad enough that I can feel the line down my face where the tingling ends. My whole right side is totally numb. But, I think, it's midterms week, and I probably just need to sleep it off and it'll be fine. Right? So I go to bed, wake up for my 8 a.m., and the numbness is all worse. Eventually, at like 10 a.m., I finally asked a friend to drive me to the ER. The ER doctor was horrified that I had ignored a very obvious sign of a stroke for at least 12 hours. It ended up being a complex migraine brought on by, essentially, a caffeine overdose and sleep deprivation. I adjusted parts of my lifestyle, including monitoring my coffee intake, and haven't had a repeat episode. Okay, I'm not a doctor, I'm the idiot who didn't come in sooner. When I was a teenager, I thought Converse were the shit, even though the pair I bought were pretty cramped in the toe. I used them all the time for pee. Here is where things started to go wrong. I started getting an ingrown toenail, and instead of taking care of it, I just try to cut the nail out and end up with this puffy red angry shooting pain in my toe. Then I notice some wetness in my shoe. It's puss. What do? Buy a new pack of socks for the next 2 weeks. Week 2, I wake up and my foot is on fire. I look and it was half red, half purple and puffy to the touch. I go into urgent care with my mom, who I don't show her the foot, just that I think I need it looked at. Doc comes in. Yay, I'll take a look, but we don't do ingrown toenail extractions. I'm sure it's not that bad. I take off my shoe. The smell. My mom turned white and had to sit down as she fell into a little litany of non-stop prayer. Doctor says, "That is the most infected thing I've seen in the last 10 years. I'll grab the kit, we need to get this toenail out and put you on serious antibiotics now. Don't fuck around with ingrown toenails." Doc here. This is far more common than you'd think. Even in Australia, where healthcare is free, I get several instances every week. The general populace is medically illiterate and or willfully ignorant, especially so when I was working rurally. A woman with a facial basal cell carcinoma, common and easily treatable skin cancer in the early phases, that she refused to acknowledge until it had eroded half of her face and developed a severe systemic infection that ended up killing her. I could see into the back of her nose from the side. One eyeball was being held in place only by muscle, the bony eye socket was completely gone, and she had no cheek on that side. This woman genuinely looked like a zombie. Poor thing. Countless folks in their 30s who couldn't feel either of their feet due to permanent nerve damage from uncontrolled type 1 diabetes. It's a tough conversation to have when they ask, "Can't you just fix them so I can go back to work?" Last week, a previously very healthy gentleman in his 60s, we're talking several long bike rides every week, who had chest pain, breathlessness and some near faints for a few days. Rocks up to Ed after collapsing with a cold right leg and his heart damage markers are through the roof. Straight to theater to have his coronary arteries stented. 100% blockage of the LAD, aka the window maker, horrendous cardiogenic shock, crap heart, crap oxygen delivery to everything else, and since his heart hadn't been pumping properly, a huge clot, static blood clots like mad, in the left ventricle of his heart that was flicking off mini clots and cutting off the blood supply to half of his organs including an entire leg. Poor dude had clocked up 200 kilometers on his bike the previous week. Had a guy show up in my clinic one day with a complaint of finger swelling. So as the story went, his finger got swollen and painful about a week prior. Just got worse and worse, and about 3 days prior to coming, a hole opened up in the tip of his finger. This is where I, personally, would have noped right to the office. So come the day of the visit, he says, "By the way, I pulled something out of the hole in my finger yesterday with a pair of tweezers, no idea what it is." I asked him if he took a picture or kept it, and he produced a tissue from his shirt pocket. It was his distal phalanx, last bone in the finger. The bone had gotten infected and the body did its thing and basically tried to eject what was now a hot foreign body. The guy pulled his fingertip out of his fingertip. A better magic trick, I have not since seen. Nurse here, had a diabetic who couldn't afford to fill his oil tank during the winter. He was young too, early 40s. Anywho. Had neuropathy in his feet so couldn't feel that they were becoming frostbitten. He had also been wearing his winter boots 24/7 for warmth. His sister went to check on him one day after she realized his phone was shut off by. She brought him in because she thought he seemed off. The doc asked me to take his boots off. One of his toes came off with the boot, no joke. He ended up having a below-the-knee amputation to one leg and a tarsum-to-tarsal amputation to the other and on 4 antibiotics for weeks. Diabetics, this is why us nurses always preach check your feet. My tooth has been hurting for a couple of months. My face started swelling a few days ago. It became hard to swallow last night and now I'm having trouble breathing. Guy had Ludwig's angina. He couldn't be intubated because of the swelling and had to get an emergency trot when he stopped breathing and his O2 stats plummeted. 4 antibiotics for 2 weeks. Admitted to the hospital for 4 weeks. Easily could have died. All because of a dental infection. See your dentist, boys and girls. I'm a dentist and saw this when I was on call during my hospital residency. Edit, to the people who were yelling at me, yeah, well, insurance. I don't see you paying for it. It's too expensive, I get it. Dental insurance is not insurance. It's a discount program you pay for, or it's a benefit from your employer. In this instance, the patient had state medical and dental coverage. It covered all exams, fillings, and extractions. He still didn't come in until it was really bad. He didn't pay a dime for the care he received. I also worked in my residency seeing 90% Medicaid patients. The other 10% were charity cases. I am acutely aware of the problems with cost for dentistry and access to care. Blame the insurance companies, not the dentist. If you are looking for cheaper dental care, look into dental schools and federally qualified health centers. The former works at 50% private practice fees. The latter works on sliding scales. In the meantime, do what you can to protect your teeth. Dollar store has toothbrushes and toothpaste. Actually use them. A vast majority of dental problems can be prevented with adequate oral hygiene. Cut out soda from your diet, get rid of energy drinks, don't live off of candy and cookies. Get in at least once a year for an exam. Not a doctor, but an army medic. Had a dude come into the aid station at like 2 a.m. with his arm all wrapped up. Took the wraps off. Shit looked necrotic. I asked him what the fuck was going on. Turns out, the weekend before we went out to the field, this man went and got his whole forearm tattooed. He then spent the next week wading through chest-deep swamps, figuring that if he just kept his arm wrapped, he'd be okay. I was like, brother no. Edit, oh yeah, there was also that time some female LT came in with vaginal pain. Took a look, saw one HAVA infection. Apparently, she hadn't changed her tampon in nearly a week. We, meaning I, while the doctor watched, had to retrieve it. I remember being in pain for years. Ever since I was 16, I've had pain in my stomach that felt like someone was gripping my insides tightly. My doctor kept telling me I was faking symptoms for pain meds, except I've never taken pain meds in my life. My stomach pains were period cramps, or gas, or afterbirth contractions. I go to the ER at the age of 21 in severe pain and they give me an ultrasound. Tons of stones including one stuck in the bile duct. The tech asks why it took so long to get checked, to which I replied I've tried but my doctor refused to because he thought I was faking. Long story short, that doctor doesn't practice medicine anymore. Or RN, Was on call on a Friday night. Got called in for an exploratory laparotomy. Some late staff had gotten the case ready and patient in the room when I arrived. I walked into the room to see the patient's testicle was bigger than a basketball, 2 people holding it up to prep it. The guy had a large part of his bowel in his left testicle, and his bowel had ruptured due to the pressure. We suctioned poop out of his abdomen for over an hour. Apparently the week before he lifted something heavy and felt a pop. Hadn't urinated in 2 days because it was so swollen his penis was not visible. That's why he finally came in, he couldn't pee. Although his testicle had been slowly growing for a week. Unfortunately he didn't make it. He lived through 3 abdominal surgeries but sepsis did him in from the ruptured bowel. I had an ex who had what looked like a nasty pimple on his thigh. I'm not in the medical field but all my friends are and I enjoy the subject. Also another ex had an abundance of staph and had gotten at least 6 staph infections during the time we were together, so I instantly recognized that this was not just a pimple but an infection. I told him not to mess with it, that he should draw a line around the redness and go see a doctor to get antibiotics. He didn't listen. Of course. That night he tried popping it. It didn't pop, so the genius that he is decided to get a pin and try to pop it that way. Well, that was probably the worst thing he could do. The next day his leg was looking really infected. The redness had grown a lot and now it was like an angry red and there was some parts that looked blue/purple. There was also now an open wound about the size of a quarter. I told him to go to the doctor immediately. Nope. The day after that he woke up with 103-degree fever and collapsed in front of his parents while attempting to ask them to take him to the hospital. He was admitted and on 3 different kinds of 4 antibiotics. When I visited him the redness was almost completely wrapped around his leg and was still growing and the wound had tripled in size and the area around it was black. They thought he had MRSA since it was resistant to antibiotics, but it was aggressive. By the 3rd day in the hospital the redness was wrapped around his thigh and covering almost his entire thigh. He ended up needing surgery to try to help deal with the infection since the wound itself was necrotic and spreading. He had the surgery and they did labs to find out what it was. Turns out it wasn't staph at all. It was strep. Necrotizing fasciitis or flesh-eating disease to be specific. Had he gone to the doctor when I said and not introduced more bacteria by sticking a pin and using tweezers on it he wouldn't have had to go through all that. I had MRSA as a child and it just started out looking like an angry bug bite on my thigh. My parents started to notice something wrong when I asked to take a nap, something I hated as a kid. When I woke up I had a 102 fever and the redness was spreading so they rushed me to the hospital. I ended up spending 3 days on 4 antibiotics and had to be quarantined away from my family while they all got nose swabbed to make sure they didn't get MRSA as well. My mother was one of those holistic medicine types who preferred to treat her chronic illnesses with herbal supplements she could buy off of the internet. She had chronic constipation for months and a persistent sore on her abdomen that would not go away, no matter how much manuka honey she smeared on it. Long story short, my brother finally convinced her to go to the doctor for this sore that wouldn't heal and they discovered that she had a tumor, the same one obstructing her bowel, that had eaten through her viscera and through her abdomen. She lived another 6 weeks. Stop diagnosing yourself on the internet, friends. My husband almost died this summer, age 36, from a dental abscess that was so badly infected. The thing was, everyone in the ED said, "Why didn't you take care of this sooner?" He had been to the doctor 6 times and the dentist 4 times over 6 months who couldn't find the issue until he ended up in the ED. It was amazing. They all thought he was one of those guys who didn't go in. I'm an EMT. One day me and my partner got called to a house for the unable to ambulated. This is a common thing we get dispatched to and it usually means someone is too weak to get out of a recliner or out of bed. We expected to go and help this person to their feet and maybe get a refusal, or transport them to the hospital based on an assessment. When we arrived on scene, a cop was there along with a neighbor who told us it was really bad in there. The second I walked through the door of the house, the smell hit me. I have smelled many dead decaying bodies that were not this pungent. We walk into the living room to find a man laying on the floor of his living room saying he could not get up. His legs were wrapped in what appeared to be plastic wrap and plastic bags. You could see the wrappings filled and dripping with brown liquid. The guy said he had started getting sores on his feet and rather than go to a doctor, he elected to just wrap them up in plastic wrap. I don't know how long he had been doing this but it had reached a point where he could no longer gather the strength to get up and he was extremely septic. It was horrible. We carried him out of the house and I was down at the legs and the gangrene juice was dripping all over me. The back of the ambulance smelled like death for days. We dropped him off at the hospital and I went outside and puked. I see nasty shit every day but this was by far the nastiest. When they took the wrappings off in the ED, the nurses told me both his legs were completely black and rotten up to the knees. They had to amputate both legs up to the hip and they found the gangrene went up into his pelvis, so they had to transfer him out for more surgery. I don't know if he lived, but if he had just gone to the doctor when it started, he would have probably just found out he had diabetes and been given medication and lived many more years with 2 functioning legs. Nurse here, there's plenty, but the latest one that comes to mind is this woman who came in for abdominal pain. Thing in, 5 days before admission, she had fell and hurt her head. It got ignored through ed because why look closely at an open head wound, and straight up to our floor, where we decided to clean her up. After cleaning up some of the blood, it seemed like the wound was moving. Surely fucking enough, maggots. Ended up cleaning them out, but I raised both the question of why would you wait and wait, you didn't even come in because if this. I once worked in a dermatology and rheumatology ward, and while the patient themselves didn't wait too long, they came from a nursing home. They were admitted the night before I came on and they had a bed sore on their sacrum, just above their ass, that was so large you could fit your fist inside it and not touch the sides. I'm talking up to your wrist. They also had bed sores on the hips, heels and shoulders. We had to order in a special sci-fi hover bed for them to try to help them. The only time in my life I've seen that machine be necessary. It is as cool as you think, by the way. They were in so much pain that they were kept sedated at all times, too. It was a nightmare trying to fix them, but eventually we managed to get them down to minimal wounds and they were discharged back to the nursing home. Within a month she was back and they were worse than before. She died in hospital. If they'd actually cared for them properly or admitted her to hospital earlier, she'd have lived. Took care of a female patient on a ventilator that needed an EEG to determine if she still had brain activity. This involves electrodes being glued to the scalp. We tried brushing her hair to reach her scalp, but her hair was matted so badly we couldn't. We had to get permission from the family to cut her hair so we could do the test. As her nurse that shift, I was given medical shears and told to get to work. As soon as I started cutting, the matted section of hair began peeling back in one piece and I realized it was, at one time, a wig that had essentially dreadlocked with her natural hair over the course of many years. After I cut this matted rug of real/fake hair off her head, a few bonus goodies fell on the sheets in the form of mummified dead bugs. I gagged. Not a doctor, but a patient. I got my period but it wouldn't stop. On week 3.5 I was feeling ill, kinda nauseated and lightheaded, so my boyfriend, now husband, drove me to a walk-in. Walk-in takes me pretty quickly and the doctor immediately takes my blood pressure. He does it once, frowns, does it again, calls the nurse and goes, "This blood pressure cuff I think is broken, let's take her to exam room 3. We go in, he checks my blood pressure again and goes, "This can't be right." My husband asks what is happening, he is like, "Has she fainted at all?" He goes, "No, why?" The doctor calls the nurse in again and goes to me, "Your blood pressure is so low, how you are even conscious is a miracle, we need to call an ambulance." So I do not know if it was the blood loss or just my twisted sense of humor, but I go gets like the movie Death Becomes Her and start laughing my ass off while denying an ambulance and insisting my husband drives me to the ER. The doctor asks which hospital and I had to sign an AMA. We go to the hospital, I check in and they immediately rush a stretcher out and I am taken right away as the walk-in doctor called to give them a heads up. Long story short, it was a ruptured cyst along with the start of a very long journey with PCOS that messed up my hormones and stopped my body from stopping my period. Total disconnection between my brain and uterus, I guess. I was hours away from needing a transfusion and DRS had no idea how I stayed awake, let alone did not need a transfusion given the amount of blood loss. So far I've been very blessed to have 2 kids naturally. DRS weren't optimistic, but also had 3 surgeries and a bout of stage 1 ovarian cancer, surgically removed because the cyst grew around the tumor, so cyst finally came in handy somewhere. The worst part is you think I learned my lesson but it happened again and it's like I go into denial. That was surgery number 2. By the time I got cancer I had kids, so something pushes you to be more diligent. The scary part is I had a late period and it was heavier than normal, and that is what made me go in to get checked out fast. Had I waited that out I doubt I'd be writing this. I'm going in for tests next week as things have gone wonky again, so fingers crossed nothing comes of it. So ladies, if your period is acting wonky, go see a doctor. Could be something. Could be nothing, but ovarian cancer is called a silent killer for a reason. I'm a nurse, and I am my own "why didn't you come in sooner?" patient. I had a sore throat and didn't think much of it. My daughter had come home from school with strep a few days before. I spiked a temp, and let it ride. My head hurt, and my neck began to get stiff. Now I'm thinking, oh shit, do I have meningitis? Fever gets to 104, so I call my own doc and explain the symptoms. They essentially tell me to fuck off until tomorrow morning. I'm like, okay cool, I'll take Advil and do that. Well, lo and behold, throughout the night my temp spiked higher and higher. I don't remember much of what happened, but I know at some point my ex-husband demanded I call in with my newest temp that was above 105, and they still told me to ride it out at home, so in my brain-cooked state I thought, yeah, okay. Well, thank goodness at one point my ex got fed up and firemen carried me to the car and drove me to the hospital I'd just finished my ER internship at. My temp was still 106 or above, and my heart rate was a bit much. What I remember most vividly was my shock at my triage rating low 2/5. That's what they made possible heart attacks. All the nurses and techs just kept shaking their heads at me like, what do you know these things? Why didn't you come in sooner? First of all, nurses don't seek care for shit. Second of all, you try remembering common sense with a 106-something fever, embarrassed smiley face. I'm late to the thread here but have to write this. I'm a 22 years paramedic and I once responded to a cardiac arrest where a police officer had called us after responding to a welfare check where she found a man unresponsive. We worked the guy but it was quite futile. The cop had started CPR after calling it in, so we continued for a half hour or so with no response to treatment. Called it after he remained in asystole without a hint of a response. The story was that the guy was out mowing his lawn when he began having chest pain. He stopped mowing, went inside, and called his wife who was at work. He told her he wasn't feeling well and wanted her to know. He then sat down in a living room chair, took out a notebook and started journaling his symptoms. The 2 sentences he wrote that I'll always remember are: "My chest hurts. It's hard to breathe. I think I'm having a heart attack." His wife tried calling him back after an hour and couldn't get him on the phone. After another hour she called 911 to request the police do a welfare check. They found him in that living room chair next to his journal, dead as can be. Literally, this guy lived a block from our ambulance station. We hadn't had a call all morning until we responded to his house. He died a block away from me and my ambulance. I was just mucking about the station. Had he just called me I could have saved him. Don't be this guy. Call 911 for chest pain, folks. I'll come. It's okay. A couple of naturalists tried to feed their child juices and do plant rubs. Kid had meningitis and now has permanent brain damage. The parents ended up getting charged with child neglect. They fought it in court. Not sure how it ended up. Idiots. Dental hygienist here. I see a lot of bad cases due to many Americans not having health insurance. I was taking x-rays on a patient once when suddenly one of her lower front teeth fell into her lap. She hastily picked it up and put it back into her jaw. It was only being held in by hardened up plaque and had been for over a year. She had to have all of her teeth extracted due to advanced periodontal disease. So many things. If I was going to choose one though, it would be an older gentleman in his late 50s that came in with a heavy cough. While doing the physical assessment my stethoscope dipped into a depression that should not have been there. I had the patient undo his shirt and found a weeping wound packed with gauze that was 8 cm by 9 cm by 1.2 cm. The patient answered my puzzlement by telling me he got bit by a spider 11 years ago, and it's just been that way since. It never got worse, so he just changed the packing every day and went on about his life. The things people are capable of just accepting and moving on with their lives will never stop amazing me. I had just gotten my first job out of college at the ER at my local hospital. My first week went by with the usual stitches and broken bones. My second week around midnight, this very obese woman came in complaining of chest pains. So we rush her back, grab her vitals and do an EKG and blood work. Everything comes back normal but this woman is still complaining of chest pain. So my supervisor and I ask the lady if we can do a head-to-toe checkup. Now this woman had a rather pungent smell to her when she came in, but I've learned to not think of it, as people in the area weren't known for their cleanliness. So we're looking at her chest and I noticed that her left breast was reddened and swollen. So I tell her that I'm going to lift up her breast to rule out any skin infections. As I lifted up her breast, a wave of noxious stench engulfed the air around me. Thank the gods for face masks. As I lifted up her breast even more, I could see in what looked like a mass of rotting tissue going into her chest. Now my supervisor ran out of the exam room and proceeded to vomit in the nearest trash can. I looked at the lady and asked her why she didn't come in earlier, as it looks like a massive skin infection was raging under her left breast. She replied that she didn't have insurance and that she didn't think it was a huge deal. So I called in a few other nurses and the doctor to assist with cleaning the wound. Well, as we began cleaning, one nurse noticed a bit of fur and bone. As we further inspected, we come to find out it's a small animal of sorts. So they collect the sample and send it to pathology. After we remove said animal, We noticed that it had rotted into her chest so much that her ribs could be seen. In the end it ended up being the lady's missing kitten and she spent 4 months in the hospital for massive sepsis and other related issues. I'm a doctor from a third world country and spent a year interning at the government-funded hospital that provides free or subsidized treatment for the poor. Most patients were poor and reported very late to the hospital, especially if it were a woman who's in question. There seems to be too many posts about gangrene, so I'd talk about something else instead. We provide a state-funded insurance for all those living here. Women are actually paid a small sum of money if they show up for antenatal visits regularly and then a little more once they complete their kids' vaccination. We also actively promote sterilization. This was during a month-long posting at the labor ward. We had to do 12-hour shifts every day, which was very tiring, considering the huge number of patients who would show up. One day, a 45-year-old woman came with labor pains. It was her 5th child and she hadn't taken a single visit to an obstetrician. She had refused sterilization, refused to use contraceptives. We checked her blood hemoglobin, it was only 4 grams %, should be at least 10 to 11 by the end of pregnancy to avoid complications. She was looking very pale, thin and sick. You could see she absolutely couldn't tolerate the labor pains. She couldn't push. We didn't have the facility to give an epidural. She demanded us to deliver the baby via C-section, but this wasn't possible as it increased the chances of her losing more blood, while her hemoglobin was already low. Also, her age by itself made the pregnancy a little risky. The government-funded blood banks run on the kind stranger who donate blood and we had to call up every other hospital to get blood of her blood group. Note, she eventually did give birth and went into a lot of complications and was shifted into the ICU. Note 2, the reason she kept having children even though they're unable to take good care of them was because all her first 4 kids were girls and her in-laws wanted her to have a boy. Former ER nurse here. Several years ago I had a patient that came in by EMS labeled as a psych patient because he told them that he had a family-size bottle of shampoo inside him. He refused to talk to anyone after arriving, but let me do an exam on him. After I found that he had a lot of discomfort when I palpated his abdomen, I spoke to the doctor and managed to finagle an abdominal CT scan. Turns out that the guy was not a psych patient at all and that he truly did have a family-size bottle of shampoo inside of him. He shoved it up his ass to get off and it not only got stuck inside his colon but it had perforated it as well. When he started talking again he said that it had gotten stuck over a week prior to his arrival to the ER but dealt with the pain by drinking a lot of alcohol. Thoughtful face. All of the ER staff couldn't figure out how this guy managed to stave off an emergency visit, let alone how he was alive. My guess is that by avoiding food and only consuming alcohol for a week he managed to decrease the motility in his gut and the size of the shampoo bottle tamponated off internal bleeding. Needless to say he had to have emergency surgery to extract it. I was working at a CBP facility assisting migrants with emergency/screening healthcare needs. I get this patient who can't be older than 50 that I'm talking to. He's part of a larger group and I'm checking them all out for scabies and etc. This guy nonchalantly goes, "Wanna see me feet?" in English. Naturally, my curiosity rises and I oblige. He wasn't in any visible distress and his gait wasn't altered in any way, so I'm not expecting any surprises. He's wearing these boots covering everything below his ankle. He sits down on the dirt and takes them off, revealing that his feet were gangrenous and eaten down to the bone. He wasn't in any pain because it ate all his fucking nerves. I was floored and was unsure why he, or anyone else in his group, didn't tell me immediately. Wild. Hope he's alright. One day, a woman came in. She was large and had a baby, along with 5 other children or so, and her husband. She was complaining in the ER about pain in her right breast, so she had to check it out along with another nurse. They asked her some questions before checking her. At first, just without looking and by the things she had said, maybe the baby just bit her and had an infection or something like that. But then, they lifted the robe they gave her. Her nipple, along with her areola, was covered in huge holes with little things moving inside of them. The other nurse threw up before calling a doctor, and my aunt was pale as a sheet. Never, in her almost 20 years of practice, she had seen something so disturbing. She said she had a lot of gross stuff, but this was horrible. The doctor, as disturbed as the nurses were, determined what happened. The baby had bit her nipple, causing a small wound. The woman's hygiene was so bad that she didn't bother on treating it with anything, nor covering it up, or even cleaning it. She left it like that. A fly, then, put its eggs inside the wound and the larvae began eating her breast tissue from the inside, or something like that. I'm no doctor, thus the holes. It had been like that so long that the flies were in the last phase of becoming a proper fly. The woman apparently had noticed it, but didn't think it was a serious problem. The flesh had started to rot while she was still breastfeeding her baby. They had to remove a large portion of that breast. My aunt doesn't understand why she didn't go to the hospital as soon as she noticed something moving inside her nipple. Anyway, people, always cover up your wounds. Had an accident while mountain biking. Nothing too serious, but my right thigh hurt enough to make me go to the hospital the same day. NADR, the hospital, a department which is basically a big doctor's office which is open when regular doctors are not, like on weekends. By the time the doc was examining me, my whole thigh had become a massive multicolored bruise with a gruesome-looking center where I probably hit the tip of a point stone or a branch during the accident. Astonishingly, the skin was whole, no bleeding or any other open wound. The doctor told me that I was lucky and that it really just was a big bruise. He sent me off with some useless painkillers, ibuprofen 400 milligrams, only thing that stuff helps with are minor headaches, if at all, and told me I should not worry, it will heal by itself. 2 days later, the bruise had taken some new colors and kept hurting, so I went to see the doctor again with the same result. Was told it's just a bruise and that changing colors means it's healing. More days went by, more colors appeared, especially the center took on some very unhealthy looking yellow shades, was swollen and hurting quite bad. This time a friend had to take me to the hospital because I couldn't drive anymore. Supported by my friend, I limped in the doctor's office. He looked at my thigh and immediately scolded me why I did not came earlier. There is clearly a big abscess below the bruise. This must be treated immediately, it might cause blood poisoning. He then continued to cut open the abscess, which freed a lot of pus, immediately relieving me off the pressure pain I felt for days, which then was replaced by an even worse pain from the big hole the doc cut right in the infected tissue of the bruise. He told me that he could not inject any local anesthetic because the area was too inflamed. He also told me multiple times that it's pretty much my own fault and that it would have never became so bad if I wouldn't have been so stubborn and just have come earlier. I tried to tell him that I actually did, in fact even twice, but he didn't listen and just kept repeating how it was my own fault. Had a teenager come in with COVID, acquired at a church COVID party. Parent had kept her at home on grandparents' oxygen, with her oxygen saturation in the 40-60s, treating her with hydroxychloroquine. By the time mom brought her in, she was in acute respiratory distress syndrome, ARDS, and mom refused to allow her to be intubated. 3 days in the hospital later, mom finally permitted it, but it was too late. Attempted to transfer her to get extracorporeal membranous oxygenation, ECMO, but it was too late. The poor kid didn't make it because of parents' neglect. So I have a good one from when I was in nursing school and we had clinicals at a county hospital, responsible for all the indigent population. A homeless guy had been living on the streets with venous stasis ulcers which developed into some nasty oozing wounds. The homeless guy didn't have bandages and didn't really care much about his legs until insects started to find their way into his leg wounds. In order to rid himself of the insects, he somehow found or was given a can of insecticide, Raid, and proceeded to spray his bare legs with the insecticide. It worked for a bit, but after a while the insecticide would wear off and the insects again found their way into his oozing wounds. So to cover his oozing wounds he would find old newspapers and wrap them over his legs after spraying his legs down again with insecticide. Well, since his wounds were constantly oozing, they would saturate the newspaper wrapping his legs. The insecticide would wear off and insects would again become attracted to his legs since the pus/blood would saturate the newspapers. So what did he do? He would spray more insecticide and throw on another layer of newspapers over his legs. This went on and on until he got to the point that finally brought him in. He could no longer feel his legs and was septic. He had shown up with a large amount of newspaper saturated with pus and covered in dead insects wrapped around his legs. That is by far the most "why didn't you come in sooner" story I've ever witnessed. Those are some nasty stories. I did not think it was possible to be that was disgusting and gross, or let yourself go that far. Please like and subscribe for more videos, and give it a big thumbs up so more people can find this channel. Tell your friends about Upvote.